Hello, everyone. I'm Anthony Gonzalez, the Program Coordinator here at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to thank you all for joining us today for our fall webinar titled Pots and Pills, Weeding Through the College Prescription Drug Study to Inform Practice. But before we get started, we have a few housekeeping slides we'd like to go over. If I can direct your attention to the right-hand side of your screen, this is where you'll be able to submit your questions for our panel of presenters. We welcome all of your questions, and please feel free to submit them at any time throughout the session. We will field the received questions to our presenter at the very end. We also encourage you to learn more about becoming a member of the Higher Education Center, which includes access to our Screen You program. Screen You is a web-based screening and brief intervention referral to treatment program. We have recently launched a new demo of the program, so we encourage you to take a look. You can do so by searching go.osu.edu/screenudemo for access. And of course, you can learn more about the benefits of becoming a member by visiting our website at hecaod.osu.edu. And with that, it is my great pleasure to introduce to you our panel of presenters featuring campus professionals from The Ohio State University, Sacramento State University, and the University of Texas at Austin. Joining us today, we have Dr. Erica Phillips Regan, an Associate Director in the Center for the Study of Student Life at The Ohio State University, Mandy Colbert, Health Promotion and Education Coordinator at the University of Texas at Austin, Rachel Alvarez, Health Educator at Sacramento State University, and Janci Addison, a fourth-year pharmacy student at the University of Texas at Austin. Thank you to all of our presenters for joining us. We're extremely excited to hear what you have to share with us, and it's my pleasure to turning it over to you at this time.
Great, thanks, Anthony. So this is Erica Phillips Regan. So if we go ahead and get started, what we're going to do today is talk about sort of an introduction to the college prescription drug study, kind of tell you a little bit about what that is. Then we're going to jump into some of the results. So, what does frequency of use look like? What are some reasons that students report non-medical use of prescription drugs? And then we're going to also talk a little bit about marijuana use and some of the insights that the college prescription drug study can share. And then last, we're going to really jump into some of the meat of the ways in which some of the institutions who participated in the 2018 college prescription drug study, the ways in which that they are using their findings from the college prescription drug study. And so specifically, we're going to be talking with partners from the University of Texas at Austin and Sacramento State University. So first, if we talk about what is the college prescription drug study. So the college prescription drug study is a multi-institutional survey of undergraduate, graduate, and professional students. We've run the study a couple of times now, but most recently in 2018. In 2018, about 26 institutions, both public and private, four-year institutions, participated in the study. And that was about 18,000, 19,000 students are in our data. So generally speaking, we broadly examine the non-medical use of prescription drugs via this online anonymous survey. And we really are asking students what types of prescription or non-prescription drugs do students misuse and or abuse? What are the demographics of these students, and why do students misuse prescription drugs and their attitudes about it? And then last, are students more likely to abuse non-prescription or sort of illicit drugs? So now I'm going to briefly turn it over to Mandy to talk about the language that we use around prescription drugs and kind of misuse versus non-medical use. Mandy?
Hi, yes, thank you, Erica. So just a quick note on language. So for this webinar, we might be saying non-medical prescription drug use or prescription drug misuse. And basically what this means is taking a medication in a manner or dose other than prescribed or as intended. So this can mean taking someone else's prescription or taking a medication that's prescribed to you, but in a dosage or in some kind of way that other than it's originally prescribed to you.
Great. So if we continue to jump on in, first we're going to talk about sort of frequency of use and a little bit about access to use. So, what you can kind of see on this slide is some of our general results for students who responded to the question, have you ever used the following for non-medical reasons? So in the CPDS, we talked about sort of 3 classes of medication: pain medications, sedatives, and stimulants. And, across all institutions, we really saw that pain medication use was in around the 9% range, 10%, that sedatives were, similarly low, around 10%, and that stimulant use for non-medical use is really where we see, an increase across the 3 types of substances, where more students are reporting that they had ever used one of these substances. One of the great things about the college prescription drug study that you can kind of see here on this slide, because Texas at Austin and Sacramento State, were willing to share a little bit of their results with us, is that partners who participate in the study, they get a little bit of comparison data. So you don't usually see, by institution data such as this, but you are able to see how does my institution compare to other 4-year public and private institutions. And that can be really useful benchmarking in terms of understanding your results. Additionally, we asked students, what their class rank was. So we're really able to see here on this slide the ways in which non-medical use tends to increase over time as students move through their educational careers, through their undergraduate years, particularly in the case of stimulants. Students who have been working on their undergraduate degrees for 5+ years, 25% of them reported that they had ever used stimulants. So we see kind of that being the highest right there. In terms of graduate degrees, we also see some use of all of these substances, although there's a little bit more variation and standardization there. What's really interesting to us is thinking through, the previous slides showed us these are students who had ever used according to their self-reports. But once a student had said, yes, I've used one of these substances, we asked them some follow-up questions. And so we asked them how often in the past 12 months they had used one of these substances for non-medical reasons. And what we really see here is a story of students not necessarily using these substances on a massive regular basis, because about 55% of students who had ever used pain medications said that they had not used them in the past 12 months. Similarly, just over a third of students who reported ever using stimulants had not used them in the past 12 months. However, we are able to see, in the case of stimulants, that about 63% of students said that they had used stimulants in the past 12 months. So being able to kind of use this information to understand students' patterns of use and understand the frequency of that use. We also wanted to know, because many of our results go to practitioners, is when did students start using the sedatives, stimulants, or pain medications for non-medical reasons? And as you can see on this slide, students are pretty likely to report that they started using stimulants while they were in college, but they're actually more likely to report using pain medications, or that they started using pain medications while they were in high school. But we can really see from this chart that students are most likely to start in college for the most part, though there is some variation in terms of high school. Now, we also wanted to know from all students, not just those who had ever used, what were their perceptions about their ability to access prescription drugs. So when we asked all students this question, we really had less than a third of students, and in most cases, a fifth or fewer of students say that they thought prescription drugs were very or somewhat easy to obtain. So it's really only when we get to stimulants that you get even close to, about 30% of students saying, yeah, I could definitely get access to those if I wanted to. But we also asked students, where did they get their prescription drug and the means by which they obtained them. So students, are most likely to say that they're getting these sedatives, stimulants, and pain medications from friends. And especially for stimulants, students are very likely to be obtaining them from friends. So this will really matter when Mandy kind of talks with us later about what's going on in these initiatives, Mandy and Janci, pardon me, at the University of Texas at Austin. Now, we know that students reported using these substances, so we also wanted to know sort of why students were using these substances and what are some of the consequences that they experienced as a result of their use. So we asked them, and students shared with us, pardon, let me just get it to move. Students shared with us that their top reasons for non-medical use of these different types of prescription drugs. So we can see with pain medications, students were most likely to report that they used them to get high and to see what it was like. But the second most reason was to relieve pain or even relieving anxiety or sleeping. So we perhaps have a bit of a narrative here around self-medication that is really important when we're having conversations about misuse and non-medical use. Similarly with sedatives, students are saying that they're using them to sleep or to relieve anxiety in addition to perhaps that get high or experimentation piece. So again, that narrative of what is self-medication potentially looking like is important. For stimulants, students are really reporting, as you can see, with 79.2% saying this, that they use stimulants non-medically to study or improve their grades. So overwhelmingly, students are really interested in the academic effects of these substances. So education campaigns around this will continue to be really important in helping students to understand their use. For consequences, students shared with us a variety of consequences, but the most common for sort of pain medications and sedatives were that they had been depressed or that they'd experienced some sort of memory loss as a result of their use. With stimulants, students, again, are perceiving a positive effect on grades, and so this is also an opportunity for potential education. We asked students a number of questions about sort of education and resources available around prescription drug misuse. Unfortunately, most students are, pretty aware of resources to help with prescription drug safety. So when we asked all students, are you aware of a resource for prescription drug safety? Over half of them were aware of either an on-campus or off-campus resource. Similarly, when we asked students who reported that they had ever misused pain medications, sedatives, or stimulants, that if they would know where to go if they were concerned about their own use, over 50%, and in fact close to 75%, said that yes, they were aware of a resource where they could turn to if they were concerned about their use. I'm going to pivot a little bit now and talk a little bit about marijuana use and kind of what that looks like in the college prescription drug study data. So we asked students sort of generally whether they had sort of ever used a variety of illicit drugs, one of which included marijuana. So of the just under 19,000 students who answered this question, about a third of them reported that they had ever used marijuana. So that's the full sample of students. And Rachel will talk a little bit about this and why this matters in the Sacramento State context in a little bit. But then we also asked students who had ever reported that they had misused stimulants, sedatives, or pain medications, if they had ever used an illicit drug in place of their non-medical use. And again, just over a third of these students reported that they had used one of a variety of illicit drugs in place of their prescription drugs. And when we drilled down and asked students, well, what did you use? What substances did you use? Overwhelmingly, they selected that they had used marijuana in place of their prescription drug misuse. So this is an interesting finding, as Rachel will talk about in a little bit, in the context of continued public health discussions around marijuana, as well as health promotion efforts around that. We also asked students a variety of questions about their prescribed medication behaviors. So these are questions we asked students in terms of students who have a valid prescription for a pain medication, a sedative, or a stimulant. What did they do with that medication? What were their behaviors around it? When we asked these students where they stored their medication, many of them were storing their medications in unlocked drawers, medical cabinets, and even in their purse or backpack. So continuing to educate students about these substances and how they can continue to protect themselves and others in utilizing these substances continues to be important. We also asked students what they had done with their prescriptions for these substances. And here we really get an interesting story because we're able to see that many students, particularly in the case of pain medications, are keeping the medications after medically needed. But the other piece, particularly when it comes to stimulants, that's particularly interesting to us, is that many students are giving their stimulants to a friend or peer or selling their stimulants to friends or peers in a way that's not really happening with sedatives or pain medications. So, continuing to have educational opportunities for students, like we're going to talk about in a few minutes, will be vital to encouraging continued conversations. So next, I'm going to turn it over to Mandy and Janci at the University of Texas at Austin, and they're going to help us, along with Rachel at Sacramento State, get into the meat of really translating the college prescription drug study findings into practice at their institutions.
Great, thank you, Erica. So hi, everyone. I'm Mandy, and I work for the Longhorn Wellness Center at the University of Texas at Austin. We are the prevention and public health and health promotion arm of our University Health Services and our Counseling and Mental Health Center. And our office addresses a broad range of health topics affecting students, including drugs and alcohol, prescription drugs, which I'll talk more about in a minute, sleep, sexual health, violence prevention, mental health, and more. And I wanted to first give a little bit of background about our campus. So UT Austin is a large public school. It's located in the capital of Texas in Austin. We have about 52,000 undergrad and graduate students and 30,000 staff and faculty. So on any given day, we have over 80,000 people on our campus. UT Austin automatically admits students in the top 6% of their high school graduating class. And that accounts for about 75% of our total student population. And I mentioned this because it creates an interesting and highly competitive environment, and it sort of breeds this almost toxic competitive atmosphere where students are always trying to get ahead, or they're trying to cope with the stressors in their environment. And for this reason, we see students turning to prescription drugs like stimulants, which Erica showed earlier. About 17.5% of UT Austin students mentioned using a stimulant that was not prescribed to them. And a lot of our students are using it as a way to get ahead, get that competitive edge, or get ahead academically, but also turning to prescription drugs as a way to relieve stress. So that's a little bit about our campus and a little more about our work to combat prescription drug misuse specifically. In 2011, 2012, our office launched a health marketing campaign called Study Natural. And over the past year, we've been working with student groups to update and relaunch this campaign to specifically targeting prescription drug misuse, and hoping to make it more updated, make it feel more relevant and useful for our current students. So we highly value and encourage student-driven initiatives. So we've partnered over the last 2 school years with a team of third-year pharmacy students who are undertaking a population health project as part of their core curriculum. And so I'm lucky that we have Janci, who is now a 4th-year pharmacy student. She's here on this call. She participated in this project last year, and I'm going to turn it over to her to share a little bit about the process and what they found in their formative research as they were doing this exploratory research to update our prescription drug misuse campaign.
Hi, thanks for having me. I feel very honored to represent the University of Texas and the University of Texas College of Pharmacy. I have felt very lucky to attend a university that talks a lot about addiction and substance misuse. The University of Texas College of Pharmacy has been very passionate about promoting primary and secondary prevention of substance misuse. UT College of Pharmacy has been really focused on secondary prevention of opioids. UT started this program called Operation Naloxone, where we provided and trained campus and Austin police and dorm RAs on how to administer naloxone, and because of this initiative, I think my pharmacy group was kind of clouded, and we initially wanted to just focus on opioids, and we wanted to promote Operation Naloxone. Because of Mandy's experience, she told us that we should read the literature, and she referred us to the Ohio State study. So we were very surprised that stimulants were the #1, followed by sedatives, which I'm not really sure why I was surprised, because I attended the University of Texas for undergrad, and I was a pre-med, pre-pharm major, so I knew how competitive it was, and I know that a lot of people were turning to stimulants because of this competitive atmosphere. But ironically, a few weeks later into our project, we talked to the head of Operation Naloxone, and 0 vials of naloxone had been used on campus. So this further proves that opioids really aren't a problem in our population. So I'm very happy that Mandy steered us in the right direction and referred us to the Ohio State study. So the main goal of our project was to conduct a needs assessment for the UT Austin. After analyzing the Ohio State study, we contacted a few key UT Austin informants to see if what they see further confirms that the Ohio study, what the Ohio State displayed. We interviewed leaders from the Counseling and Mental Health Center and the Centers for Students in Recovery, and they confirmed that after alcohol and marijuana, stimulants were the most misused, followed by sedatives. Interestingly, we found that most students were obtaining medications from family and friends, but we also found that a lot of students at the UT campus are using phone applications and the dark web. So there's this application called Yik Yak, where people can post listings on or what they need or what prescription meds they want, and it'll disappear later in like an hour. So along with questions about these, we also talked to the leaders about current UT intervention programs and also where UT can improve. UT has worked really hard to create a safe environment for students who have struggled with substance misuse. Some of the current intervention programs include the Center for Students in Recovery, which is a group dedicated to academic success and peer support, the Counseling and Mental Health Center, of course. They also have an amnesty policy. So in Texas, if you call the police when someone has an overdose, the person that can call the police can also get in trouble. So the University of Texas has an amnesty policy where they protect students who call the police for drug or alcohol overdose. Of course, I've already mentioned Operation Naloxone. That is a huge initiative that UT Pharmacy has undertaken. Also, the Sober Living Project, which is a new program. And so what that is they have dorms reserved for people who are committed to living sober. So they'll have a whole floor in one of the dorms that if you are wanting to be sober, you can live in that dorm. And then last, the Longhorn Wellness Center, which Mandy was talking about, that is promoting, doing health promotion workshops and misuse prevention. Along with talking to UT key informants, we wanted to talk to other universities about what they were doing. So we reached out, we emailed all of the universities that were a part of the Ohio State study, and we heard back from 3 universities. So we heard back from University of North Carolina, University of Wisconsin, and University of Michigan, and of course the Ohio State University. So we all have very similar initiatives and goals. But a lot of the other universities had stricter prescription policies. But I really enjoyed speaking with Ohio State. They stressed the importance of peer education, and they also used Generation RX, which I really like Generation RX because I think pharmacy students would be really good peer educators on prescription medications. But after talking with everyone, the UT informants and the other universities, we believe that future students, future pharmacy students, and the Longhorn Wellness Center should focus on peer education. So I believe that we can do this through social media campaigns and education during student orientation. So I've really enjoyed working on this project. I've presented, and my group presented at one conference, and Mandy and I presented at another conference with this information, and we actually won best presentation at one of the conferences. So that's exciting. I'm really sad that I'm unable to implement any of these programs and continue the project, but I know the UT students and the next UT students will continue to do a great job. I'm really thankful that there are so many people that are passionate about prevention and lowering the stigma around addiction. So as a pharmacist, I'm going to do the best I can to raise awareness about addiction and dispel the myths associated with stimulants. Thank you so much for having me.
Thank you so much, Janci. It's so great to hear from you and your perspective, and also just hear from the students that we're working with, particularly pharmacy students who are very entrenched in the clinical day-to-day of being a pharmacist. And I really appreciate that UT Austin allows them to step outside and consider population health and primary prevention, in addition to the clinical side of the work of a pharmacist. So thank you, Janci, for talking a little bit about your research. We do have a new pharmacy group of students this year who are basically taking the recommendations and research that Janci's group started last year and digging in a little deeper to develop new health marketing strategies, to strengthen our peer education component, to research and implement maybe online educational modules as a way to provide baseline level knowledge for all UT students, and also as a way to reach such a large campus of 50,000, 52,000 undergrad and graduate students. And they're also working on creating promotional efforts around our drug take-back day, which I'll describe in a little bit. But they're also working alongside a undergraduate health communications class this fall, who we basically gave them a lot of the research that Janci's pharmacy group did and presented that to them to breed ideas of a new health marketing campaign that will be displayed in social media messages, in posters in the dorms, and our digital screens that are featured across campus. So we're hoping to have that campaign ready by the end of this school year. Next slide. All right, so some more work we're doing on this. We've established really close partnerships with our on-campus pharmacy, the 40 Acres Pharmacy. This pharmacy serves students, faculty, and staff, and they came with us wanting more promotion and education around how to protect your prescription. And I know Erica alluded to this, but how a lot of students are diverting their prescriptions in some way. Giving their prescriptions away to friends and family, or just keeping them when they're no longer needed. So we wanted to do more research, more education around this, knowing that 69% of UT Austin students are either giving away their prescription to friends and family or keeping it longer than needed. So to target this behavior, we developed the poster on the left, that yellow poster. It's hung in the pharmacy waiting room and consultation bays, which you can see in that picture. There's also a small handout that goes with this. It's the same information as a poster, but it's a small handout that goes into all the prescriptions, all the prescription packages of all stimulant, pain medications, and sedatives that students and faculty and staff are picking up. So hopefully it serves as a cue to action, a reminder around keeping, and in case you can't read it, it's a little blurry, about how to keep your medicine safe, reminders about not carrying your full supply with you, setting reminders on your phone to either take your daily dose or for refills, and also bringing expired or unused medications to the 40 Acres Pharmacy. They have a safe disposal box there. And there's also language on the bottom about what to say if someone asks for your medication. So this is hopefully empowering students, but really anyone who's picking up a prescription, because it's not just students who are being asked for prescriptions, even though that's who we're targeting. So things that they can say in case someone asks, and to help avoid that peer pressure. So they can say, I'm almost out, actually don't take that anymore. I'm worried you'll react badly, or I actually only have enough pills for me. So we're hoping this kind of campaign will help students, again, feel more empowered to protect their prescriptions. I'm going to click to the next slide. And then lastly, I talked a little bit about the UT Drug Take-Back Day. This is our biannual event that we have at the end of each semester, and sponsored by several of our campus partners, including the Center for Students in Recovery that Janci mentioned earlier, and also our Committee on Substance Safety and Overdose Prevention. This day is important to hopefully help spread awareness about how to properly dispose expired or unused medicines, and offering opportunities to do so easily right here on campus. We also direct students to the 40 Acres Pharmacy for future disposal needs. As I mentioned, they have that safe disposal box there. So again, we hold this at the end of each semester, knowing that that's when students are probably cleaning out their dorms or moving or finding old prescriptions that they might want to get rid of. We incentivize participation. We have snacks, we have pizza, we have t-shirts that we give out. And we try to locate the drug take-back event in a way, in a place where it's easy to drop off by car too. So it is open to the broader community, but in case people don't want to walk over, they can always drive up and really quickly drop off their medications. So as I mentioned earlier, we're working with that pharmacy group this year to hopefully develop new marketing to make this a bigger and better event for this coming school year. And yeah, that's just a snapshot of some of our programming. I'm happy to answer any questions at the end of the webinar, but now I'll introduce Rachel Alvarez from the Sacramento State University to share a little bit more about their programming. Thank you.
Perfect. Thank you so much, Mandy. So as was mentioned earlier, my name is Rachel Alvarez. I go by the pronouns she, her, and hers, and I'm the health educator for alcohol, tobacco, and other drugs here at Sacramento State. So just to give you a little bit of picture of Sacramento State, we have about 30,000 students, with the majority of them actually being commuter students. So we do have students that are flowing in and out of campus all the time. So when we're thinking about programming, that's really, really important to keep in mind that we have a multifaceted, plan for reaching as many students as possible. So like Mandy and Erica were alluding to earlier, I'm going to be talking about marijuana programming. So the College Prescription Drug Survey does focus quite a bit on stimulants, sedatives, and pain medications. But when we considered just as far as our capacity with time, money, et cetera, we really realized that we needed to focus most of our efforts for the 2019-2020 school year on marijuana. So marijuana was legalized in California back in January of 2018, and marijuana on our campus specifically and throughout the entire College Prescription Drug Survey results is perceived to be easier to access, cheaper, and less addictive than prescription drugs. So there's really quite a few assumptions that are made by the students when they're considering using marijuana products. So as far as kind of starting the thoughts around programming, we really, as a university, and specifically on the health and student affairs side, needed to talk about what stance we took as a university, what method of approach that we wanted to take, and also the language that we wanted to use around marijuana. We know that it can be a touchy subject for some communities, and we needed to make sure that we were able to reach as many people as possible without offending anybody. So marijuana is legal on the state level in California, but as a campus that follows federal law and also gets federal funding, it is illegal here on campus and considered an illicit drug. So in the initial stages of marijuana programming, we had many conversations with key stakeholders, including our Student Affairs Office and specifically our VP of Student Affairs, our Student Health and Counseling Services lead staff, Sac State Police Department, et cetera. And we decided that as a campus, we really wanted to take a harm reduction approach. And when people think about harm reduction, they just assume that prevention doesn't have a place in it. And we very much believe that prevention does have a place in it. And we always promote prevention first. And then if a student is using or if a student wants to have conversations about different products and strains and things like that, then we do approach it more on the harm reduction side. Also, there's so much different language that's used to describe marijuana products, from marijuana to cannabis to pot and weed. And we really had a lot of conversations with our students around this and decided to go with marijuana as kind of our primary word of choice when we are describing marijuana products. Cannabis, a lot of the students perceive that as being medicinal in nature, and really cannabis is a word that was is being pushed by the marijuana industry kind of to move away from maybe some of the more derogatory terminology. And then things like weed, pot, the kind of those type of terms were really viewed as juvenile and almost criminalizing the plant itself. And so, as a health center, we use the term marijuana. Okay, so looking ahead to the different types of programming that we have, the first type of programming that we have here on campus and that has really yielded some awesome results is our health education sanctioning. So for this programming, our partners are with the housing department, the athletics department, and the conduct department. And conduct handles any student that, is intoxicated or maybe acting belligerent that does not reside in housing. So with this educational sanctioning, what happens is the representative from either of those three departments will reach out to me with the student numbers and let me know which substance they're caught with. So we provide educational sanctioning for alcohol, marijuana, and tobacco products, specifically vaping or vaping of marijuana. And what I'll do is I have the student do the Screen U platform for marijuana and for alcohol, and that is with the Higher Education Council. And really, that's just an anonymous kind of tool for the student to look at their own personal use, get local and on and off campus resources, and really just, kind of think for themselves, am I a high risk user? Am I a low risk user? What does that actually mean for me? And kind of start prompting those thoughts about okay, is my use normal or not? Do I need to seek further help, and so on and so forth. So after they complete the Screen U tool, they will set up a 1-hour consultation with a peer. So I manage a team of student peer health educators, and I train these students on how to run these one-on-one consults. So we have 3 different consult types. One is called Weed It Out, and that is our marijuana education. One is called Choices, and that is alcohol education. And then the third is Holy Smokes, and that is vaping education. All 3 of our programs we made it this year, or all 3 of our consults include marijuana education, since that is kind of our push for the year. And then the students will have the one-on-one peer consult, and it's really a time for them to talk about their individual use. To make sure that if they are going to use, they're going to get home safe, and then we want to encourage them to lessen their use or to quit altogether. And to date, we've had 50 students sanctioned and who have completed their consults, and so far the feedback data is looking really, really promising as far as them. We do a pre and post survey, so as far as them growing in their knowledge, but also their reaction to the program on a whole. The second type of programming that we do, we actually provide classroom workshops. So in the past, we have provided classroom presentations, but we really wanted to shift from that this year because, in our feedback surveys after the presentations, we were getting quite a bit of feedback from the students that they wanted it to be a little bit more interactive. Some of the classrooms that we go into are really early, 8 a.m. classes or even earlier sometimes. And so it's really important to be able to engage the students and meet them where they're at and give them opportunities to participate both anonymously, whether that's through kind of like those fun, like Kahoot platforms or whatever it might be, or a little bit more public. And, that's through like open-ended questions and stuff that we ask to the classroom. So we have 3 different presentation types and workshops. And in all of our workshops this year, we did include marijuana education. So the 3 presentations are Let's Be Blunt, and that specifically is marijuana, Party Safer, and we did it in a trivia style this year, and that is alcohol and marijuana and some topics of consent as well. And then Holy Smokes, which is vaping and marijuana education. So to date, the team has completed 13 workshops, with each class ranging from about 25 to 45 students. So it's a really good way for us to kind of have like a sweep effort, educate, a number of different students, be able to engage with them, and also share different educational resources. All right. So a third type of programming that we like to do here on campus, and this is really where we're able to touch the most amount of students. And if you have events that happen on an annual basis or even every semester, then they really start to get to know the faces of these peer health educators. and also us as a staff. And so it's a really good opportunity for us to not only interact with the students, but also get the faculty and staff involved as well. So the 3 events that I want to highlight, back in October on the 25th, we held the Substance Misuse Prevention Summit, and this was the first summit of its kind, being that it wasn't made for health professionals. This summit was actually for Sac State community only, so students, faculty, and staff. And it held a number of different speakers, including marijuana, vaping, we talked about Adderall, consent and substances, and then sedatives and sleep hygiene. So we had 69 participants in total. It was really well received, and we're still getting some feedback on that. But as a whole, the campus community was really excited that there was something that was just for them and wasn't just for health professionals. The second event is Rough, Puff, and Roll, and that is actually coming up on the 21st of this month. And it's in honor of the Great American Smoke Out, which they've kind of started to include vaping as well, so Great American Smoke and Vape Out. We have invited the Sacramento SPCA to come and bring therapy dogs, and they're also bringing a bunny as well. And then we're going to be using information and marketing materials from the UC Davis School of Veterinary Medicine to talk about the effects of second and third hand smoke and vape, not only for tobacco products, but also for marijuana products. So again, thinking about how we really want to be talking about marijuana as frequently as possible, because we do see such high use among our students. We're really trying to incorporate it into everything. So really the idea around Rough, Puff, and Roll is to encourage them to come over, because anytime a student sees a dog or a bunny, they want to come over and touch it, and that's totally fine. They come over and pet them. And then we're able to really educate them on the spot and start having those conversations and making current users think about, things externally from their own bodies. And then lastly, the last event that I want to highlight is our Earth Day event. It's called Blow Bubbles, Not Smoke, and that'll be taking place in April. So, Earth Day really traditionally is about thinking about our planet and kind of how we as humans interact with it, looking for sustainable practices, thinking about, protecting our environment. But we really wanted to kind of incorporate, again, that idea of okay, if you are using marijuana products or you are using tobacco products, it is possible that your use is going to affect not only yourself and, even dogs and people and pets and things like that, but also the earth. So we really like to incorporate conversations about tobacco and marijuana products in there as well. All right, and then the last little piece that I want to talk to with regards to our marijuana programming is how we are collaborating and finding intersectionality between other areas of health on campus and marijuana use specifically. So like I mentioned, I manage a team of students that are peer health educators, so they're specifically housed within my cohort, which is alcohol, tobacco, and other drugs. But we also have 2 other cohorts that I'm going to highlight. So one is our healthy relationships cohort, and they specifically talk about sexual health, issues of consent, intimate partner violence, things like that. And as we've been having our consults, specifically our one-on-one consults and our classroom presentations, we've been hearing from quite a few students that they don't believe that using marijuana products and consent are actually linked. So, just like with alcohol, I feel like most people understand that using alcohol and then consenting to sexual activities is not actually good practice of consent, and that it isn't consent. But, we're kind of hearing quite a bit of pushback with regards to marijuana. So people feel that it's less impactful, that they are able to really slow down more and make better choices for themselves when we know, specifically as health educators, and health professionals, that anytime somebody uses any sort of substance that alters their reality, they really shouldn't be giving consent. So we're going to be working with them in the coming months to kind of develop language and programming around consent and marijuana use specifically. And then the other cohort that I want to highlight is our Active Minds or mental health cohort. So I mentioned for the Substance Misuse Prevention Summit that we talked about sedatives and sleep. So what we're finding is quite a few of our students are using marijuana as a way to cope with stress and to get better sleep. And so we plan to really collaborate more with our Active Minds cohort to have more of those conversations about sleep hygiene and, what are you doing before you go to bed? Are you looking at your phone? Do you actually need to be using marijuana and other substances to help you sleep and to help you sleep effectively? Or is there, something else going on? And then lastly, marijuana is an issue of social justice for quite a few of our communities of color. So we really, looking forward, want to partner more with, campus departments that deal with race or ethnicity, whether that be the Multicultural Center. We have an MLK Center that deals specifically with our Black students, Full Circle Project that deals with our AAPI students, so on and so forth. And then also we get quite a few questions about DUIs and racial profiling, especially being that there is no breathalyzer yet for marijuana, only for alcohol at this time, and the rest of it's based on visual symptoms and doing some of the physical tests, field tests. And then lastly, sexual and or gender identity. So having more conversations with our Pride Center, our Women's Resource Center around marijuana use, and then, obviously talking about, issues of consent and some of those other really, really pivotal pieces. All right, and that's it for me.
Well, perfect. Thank you to all of our presenters today for sharing their insight and experience. At this time, we welcome any of your questions that you might have for our presenters. I do have a question ready for you right now. Both University of Texas and Sacramento State University shared some of their programs happening on their campus. For campuses that aren't at that point, could you share what the beginning stages look like and any recommendations you have for a campus to get started?
I could start. This is Mandy. I'm from the University of Texas at Austin. So this is what we did really this past year. We did have some preliminary programming and research that we had for our previous campaign, but we really used the OSU study as a jumping off point, which we conducted on our campus in spring 2018. And then the next school year, that's when the pharmacy third-year students were looking for a project. And I kind of guided them through the process of doing some of that formative research. So they did a literature review to see kind of best practices, what was the data out there on prescription misuse prevention for campuses, for colleges. We also had them do key informant interviews with experts on our campus. So I know Janci mentioned that they talked to our counselors who work in alcohol and other drug prevention, and our Center for Students in Recovery, and some of our pharmacy folks and researchers. And they also did some baselining with what other campuses, kind of peer institutions, were doing around this programming. And with that, they kind of developed this robust sense of recommendations that we're now trying to implement on our campus. So if you're trying to get started, I would give yourself some time to do that research and dig in to see what is the need on your campus, and finding those stakeholders and key informants on your campus to get a full picture of kind of the strengths, the gaps, the needs, all of that. And then also seeing what other institutions are doing and how you could borrow or tailor or some of their initiatives at your own campus.
Yeah, so this is Rachel. I definitely agree with Mandy just as far as you really need a good base of data and kind of looking at, for your specific institution, what are your needs? So just like we were talking about here today, the results of the College Prescription Drug Survey for Sacramento State really just reaffirmed our idea that, marijuana was kind of going to be where we needed to focus most of our attention on, and then we were going to be keeping an eye on prescription drug use and misuse on our campus kind of for future programming. But I also think that Another thing that's really important is looking at your own capacity. So I'm not sure for the person that asked the question if you're housed within like a health or wellness center or kind of where you are on your campus. But really thinking about what departments, what campus entities, or even what different schools, so like health sciences, the pharmacy schools, if you have one, things like that, can really jump in and help you do programming, because many hands, really can make light work. And it might be something, that you start like a committee for, like we have a substance use team here on our campus that I run and maintain. At that point is when I really get all of the key stakeholders in the same room to talk about what we're seeing on campus, who can do what, and kind of the direction that we want to move as a team.
Thank you for that response, Mandy and Rachel. I have another question. What training do you use for your peer educators?
Yeah, so I'm guessing that was for Sacramento State University, since I talked about the Peer Health Educator Program. So our Peer Health Educator Program, just to give you a little bit of background, is actually an internship. So students, they apply the previous year. We do require them to have a full 1-year commitment. So they are getting units for it. So they are given 2 units, and they have to complete 90 hours per semester. We have a class every single Friday that's 2.5 hours, where we really give them a base understanding of health and intersectionality and kind of different topics within the larger public health sphere. But as far as how we specifically train our peer health educators on the consults, so myself and my 2 student managers, who are actually considered employees of the university, but who I oversee, we develop the presentations, and we do that using obviously peer-reviewed material, things from the CDC, so on and so forth, SAMHSA, and then we design a set of slides. And then from that point, we will have the peer health educators watch us do a consult. And then they're expected to practice it during office hours, so during their internship hours. And then before we kind of let them loose to run consults on their own, we will oversee them. And so it's kind of a checkoff process where they watch us once or twice, we watch them once or twice to make sure that they're touching on all of the important points that they need to. And then they're able to do consults. And then we also have facilitators guides designed for each one of the presentations, so that they have some background information and they can really get a good grasp of what it is that they're saying and why they're saying it.
Perfect. Thank you very much. I have another question. How do you differentiate between prevention and harm reduction education on campuses where marijuana is still legal, such as Texas?
Yeah, so when we're talking about prevention and harm reduction at the same time, typically what we like to do is we like to start off all of our presentations and consults with a blanket statement that says, we're not here to tell you how to use, but of course we encourage every student to not use substances and not self-medicate. And then as we're going along and having conversations, if they're having questions about marijuana, we just make sure to include that piece every single time, so that it doesn't sound like we're making recommendations on marijuana use. And then also we like to, for students that aren't current users, most of the time they'll let us know, like, oh, I'm in here for a consult, I got sanctioned, but I actually was just sitting in the room with my roommate, for example, that uses marijuana, but I don't actually use marijuana. So whenever we have a student that says that, we always reaffirm and always applaud them for that. And we always say, that is so great to hear that you're not using marijuana products, and I really encourage you to continue to not use. But we're still going to be going over these different consult slides, and we're going to talk about different resources that, maybe you would need in the future, or maybe somebody that will need these resources in the future.
Perfect, thank you. That is all the questions that we have at this time. Big thank you to our presenters for being with us today and sticking around to answer those questions. Just a reminder that this session's recording will be uploaded to our website within 3 business days. Thank you to all of you who have joined us today, and as a reminder, it is not too late to register for our 3rd session in our Harm Reduction Learning Collaborative titled The Opiate Crisis and Implementation of Naloxone in Training on College Campuses, Legal and Policy Perspectives, featuring Dr. Valente from Naugatuck Valley Community College and Corey Davis from the Network for Public Health Law, happening tomorrow, November 13th at 2 p.m. Eastern Time. Visit our website or reach out to us at the center to learn more about gaining access to our current and past learning collaboratives. Thank you, everybody, and enjoy the rest of your day.